My name is Kevin Miles. I am the Southeastern Regional Director, and I did want to speak just very quickly as we are dealing with the ramifications of the COVID-19 virus and all of the precautions and things that we need to take so we can keep ourselves and our families safe. And certainly you're going to hear a lot about that this evening from a whole host of speakers. I wanted to spend a little bit of time speaking directly to us as a group of activists and as a group of leaders in our community to also talk about while we are taking these steps personally to make sure that we're safe and to make sure that our family is safe, there are some vulnerable parts of our community that also need to still be looked out for. There are some things that we need to do within our advocacy role because we know that despite the challenges that we now face, our role as advocates on behalf of our community doesn't stop. And there are some steps that we need to take to make sure that the most vulnerable in our community are also protected during this time. The first thing that I wanted to just briefly mention to everybody is that we need to be mindful of some of the challenges that are going to face students in our community as the schools are beginning to close. Certainly, as you look around Georgia, most of our school districts are already closed for an indeterminate amount of time. It is not unreasonable to believe that there may be some districts that go ahead and close for the remainder of the school year. Certainly, we've already seen that in other parts of the country. The question becomes, as those districts try to move very quickly towards a new model so that the children are still able to learn that involves homeschooling and some of the education to be done electronically and by computer, we need to be mindful of the fact that not all of the families in our community have computers in the home. More so, particularly when you get down to the rural areas in South Georgia, we also have a number of communities that don't have broadband or don't have reliable broadband service. So it's imperative that we as activists and as advocates, even as we hear the school district rolling out their plans to change the model on how educational services are delivered, we need to make sure that we are asking those critical questions about what is to be done for those young people who don't have a computer or who don't have broadband in their home. And, I don't know that the answer is going to be easy, but there needs to be one. So we need to really start pushing on that. Also, the next thing I wanted to talk about was criminal justice. We've seen in several communities that courthouses have started to close for all but essential functions. Now, initially, that didn't seem like too big a deal because everyone assumed that this would be about a 2-week event. We're going to close down schools for 2 weeks. We're going to close down courts for 2 weeks. But certainly, as we see the number of cases escalating, I think the most current number is the number of infections in America has now passed 13,000. This is not something that's going to be done. It's not going to wrap up by next Friday. But as courthouses close for everything but essential functions, we also need to be mindful that there are people who are currently sitting in jail who have not been convicted of a crime, who may not be able to secure a court date because those type functions may not be seen as essential. And given the fact that everybody has a right to due process, there needs to be some consideration given for the fact that, a person who is in jail minus a conviction, who hasn't been convicted of anything, it is, in fact, unreasonable to expect that they would just remain in jail for an indeterminate amount of time simply because we are dealing with this virus on the outside. I think that the way that we address that as advocates and as activists is that when we see courthouses closing for all but essential functions, understand that it may be necessary as an organization, as a group, as a community, to remind your local court system that protecting people's civil liberties is, in fact, an essential function. And that data on the number of people who are being held, who are unable to secure a trial, we need to make sure that that data is readily available, that it's being produced, and that it's being monitored. Similarly, interestingly enough, it was just yesterday that the first guard and inmate in Rikers Island Prison in New York tested positive for the COVID-19 virus. We need to be mindful here in Georgia, that the conditions inside of jails and prisons cannot be aligned with the necessary precautions to protect yourself from COVID-19. They're not designed for that. The people are packed in a very dense population. They're in very close quarters. They have shared materials and old materials. All the facilities are older, and it's all shared, and they have very limited sanitary equipment. Given that, if someone inside of one of those institutions were to become infected with COVID-19, it would theoretically, most likely it would probably spread through that population very fast. We could expect that population might actually become a hot spot for the virus. So how do we protect against the possibility that, an inmate might be infected by the virus and spread it? Well, what we need to do is we need to make sure that the jails and institutions in your respective communities have protocols in place with robust screening and testing protocols for all of the corrections workers who move inside and outside of the facility. And there needs to be some detailed contingency plan about what's going to happen if there is a confirmed case inside the prison. They don't have the resources. They don't have the real estate to necessarily start quarantining people inside the prison away from all the other prisoners, particularly if it starts to spread. So we need to make sure that those conversations are happening in advance of an issue, in advance of a crisis, to make sure that there is a contingency plan in place. Also, and I promise you guys I'm moving very quickly and I'm going to wrap up here shortly, we also need to look at juvenile justice issues when we have minors who are in juvenile detention facilities, because those minors who are in juvenile detention facilities are required to have some visitation. That visitation is one of the things that helps to basically helps to move them back into a positive direction and re-socialize them in a way that is more positive and away from that antisocial behavior that may have gotten them into the juvenile justice system. However, we are seeing, as a result of the spread of COVID-19, facilities are canceling those visitations. Again, the idea is to move towards electronic means and electronic visitations, which in theory sound great, but again, it has that same issue for families who don't have reliable broadband or a computer in the home, or even if they were to just extend the number of times that those youth could reach out to their family members by phone calls. For those of you who are unaware, the rate for a phone call into one of those correctional institutions is astronomical. It can be anywhere between $5 and $15 a minute. Well, if you are a low-income family, even if you were allowed unlimited calls into a facility, you may not be able to take advantage of that. So we also need to make sure that there are conversations taking place, if there's a facility in your community, about how we're going to ensure that the people who are not of great financial means are able to have visitation with their young people who are in the juvenile justice system. And for people who are homeless and for the working poor, I don't know how many conversations I've had with people who, lament the fact that they say that the African American community is not taking this serious enough. But we also need to be mindful of the fact that not everybody in the community has the financial means to stockpile 2 or 3 weeks worth of food. Everybody doesn't have the means to go in and buy 65 rolls of toilet paper. So there are people in our community who may have to go to the store and buy as they need it. But given that there are people who need to go in and find those basic supplies as they are needed or as their means allow, we need to make sure that our communities, our cities, our municipalities have resources set aside for people should they find themselves in dire circumstances. If this drags out for a prolonged period of time, there may be instances where someone who's in need of water or in need of some type supplies from the grocery store, but who is not able to stockpile it in advance, they may go in the store and not be able to find those things. So does the city check to find out if your city has some basic supplies in an inventory that would be set aside for people who find themselves in those type circumstances? for the people who are homeless and indigent, as bars and restaurants and stores close. Those people don't have access, or they may not have access to soap and to clean water, and certainly not to hand sanitizer and those type things. They don't have the ability to practice social distancing if they are relying on the generosity of strangers just to survive. So we need to make sure that your city has adequate shelter facilities. And in those shelter facilities, do they have the supplies necessary to make sure that people are able to stay safe and keep themselves free from this virus? And then lastly, as we look at election protection and the census, I don't want to spend too much time on it because I know you're going to hear more later, but we need to take a look at how we can put more information out in the community about how people can get absentee ballots. There are some opportunities for us to do that through some virtual phone banking that doesn't require people to come together in one central facility, but it allows people to go ahead and make calls from the comfort of their own home. That's something that the state conference can coordinate, and we can work through the state conference on that. But we need to give some real attention to making sure that the people in our community have the information they need should they decide to go ahead and send their vote by mail or by absentee, that we are providing them with that information in advance, particularly since we have this new window with our presidential primary being moved to May 19th. So that's basically what I wanted to share. So President Woodall, unless anyone has any questions, I'll go ahead and pitch it back to you.
Hi there, everyone. Can you hear me?
Yes, we can hear you.
Oh, wonderful. Thank you, Kevin Miles. My name is Noelle Singleton. I am the founder of Afro Swimmers, and I'll be your moderator this evening. I apologize. I was having some issues unmuting myself, but I could hear you loud and clear. Kevin, thank you so much for reminding us of the importance of this fight and this conversation, and just making sure that we are representing those who are not in a position to ask the questions, and making sure that we're getting the information to the community so that we can all get through this together and successfully. Next, we have Jerry Gonzalez, our Executive Director. Jerry, are you here?
Yes, I'm here.
Wonderful. Thank you so much. We also have Majority Leader Mike Dugan on the call, our State Senator. Okay, we also have Taifa Butler, our Executive Director. We have Dr. Jasmine Clark, microbiologist and state representative. We have David Dreyer, Esquire, state representative.
Hey, thanks for letting me on.
Thank you for being here. We have Charmaine Ward Milner, our Director of Corporate Relations. And we have Matthew Wesley Williams, our Interim President. And to follow, John Powers and Julie Hauk. Thank you all for taking the time to be on this call this evening. As Kevin Miles has already wonderfully articulated all of the reasons of why we are here this evening. And so what I'm going to do is I want to remind everyone that there are two ways to submit questions during this call. The first way is to go to www.naacpga.org and submit your questions. The second way to ask a question is to wait until our Q&A at the end of the call. We will have during the Q&A, you'll be able to ask questions freely, and we'll be able to get more dialogue. We're going to go ahead and start the conversation. So let's see here. We're going to take this call. This question is directed to Mr. Dugan. What do you think will happen with several universities and their graduation dates coming up? This question comes from Kiana Gandhi. Senator Dugan, are you there?
Ms. Noel, what we can do is before we go to those questions, we'll have every speaker be able to get a few minutes to kind of share with the call, and then we'll go to the questions afterwards.
Oh, okay. Yes, we can do that. So you want to start with Mr. Gonzalez.
Thank you. Can you hear me?
Jerry Gonzalez. Yep, we can hear you. You have the floor.
Thank you. My name is Jerry Gonzalez. I'm Executive Director of the Georgia Association of Latino Elected Officials, also known as GALEO. Thank you for the opportunity to be with you all tonight on this very important statewide call. These are trying times for us all. We must learn to lean on one another during these times. The challenges we will face are many, but there is nothing that we cannot overcome if we work together. And that's why I'm proud to be a partner of the NAACP and make sure that we can work on things together. I do want to make note that I've been getting notifications that many community foundations across the country, and in particular across the Southeast, are in the process of creating funds to provide some type of emergency assistance. So more information is going to be made available as that becomes more public. And as we will be posting a lot of that information on our social media channels to make sure our community members that are in dire need are aware of the resources, the emergency resources that will be available associated with that. Also, I would like to take this opportunity to make sure to consider those that do have the means to be able to donate some extra food to your local food pantries to ensure that those that are without enough food to eat will get some access to food. It's really important as we're seeing something that we've never faced before as a country like this. I wanted to talk about two primary things tonight. The first being the census. Census is vitally important to our community's power and resources, and we must make sure that despite the fact that we are in not a normal state of affairs as a country, we need to make sure that we do everything we can to encourage everyone we know to participate in the census. As of today, 11 million people nationwide have self-responded to the 2020 census, and we're very happy with the progress that's been made. Residents can self-respond to the census online at my2020census.gov, and they can do so also by dialing in to the Census Bureau, both in English and Spanish and several other languages. The English number is 844-330-2020. That number again is 844-330-2020. It's vitally important to make sure that people do respond to the census because redistricting is based on that, and also federal resources are identified and divided up across the country based on the responses in the census. As we see with the current pandemic crisis that we're facing, there's many areas that are lacking in resources, and that just points to the importance of making sure that we all respond to the census to make sure that appropriate federal resources are available to all of our communities. And then the last thing I wanted to briefly speak about, and I know that there's other more qualified people to speak about the election as well. Because of the coronavirus pandemic, Georgia has moved the presidential primary from March 24th to May 19th. There's a lot of questions about the processes moving forward and making sure that we can adhere to public health in the best ways possible. And I'm sure that the state will step up and do the right thing to make sure that we protect the health of all Georgians, but at the same time ensure that our democracy remains vibrant and strong, and all of us can participate and exercise the right to vote freely without any undue burdens for the May 19th election. There's questions about what has happened if you've voted in the presidential primary, if you've not voted in the presidential primary, if you've not voted yet in the presidential primary. Starting on Monday, March 23rd, voters can request mail-in absentee ballots for the May 19th election. The May 19th election will include the presidential primary as well as the regular general primary elections that will happen in Georgia. So we do urge voters who do wish to vote by mail to mail in an absentee ballot request as soon as possible after March 23rd. There's a process to do that, to make sure that you do follow those processes, and many of your local chapters will be able to help you with that process as well. So what happens for those that have already voted in the presidential primary as well? Those votes will be counted. We've been assured that those votes will be counted, but they can still vote for the other parts of the election that they have not voted in yet for the May 19th, and a request for a mail-in absentee ballot may also be done for that election. So make sure that that people are aware of those processes, and clearly we're not sure when the coronavirus pandemic may peak and subside, but certainly I think planning ahead and making sure that we can have access to mail-in absentee ballots, I think is going to be a great option for many Georgians to exercise the right to vote. And with that, I'll close my comments at this point.
Thank you so much, Mr. Gonzalez, for that information. For as we are listening to our speakers, and if you have questions, remember there are two ways to submit those questions. The first way is to go online to www.naacpga.org, and you can also wait till the Q&A at the end of the call. Next, we will have Majority Leader Mike Dugan, our state senator.
Good evening. Can y'all hear me?
Yes, we can.
Okay. Well, first of all, thank y'all for letting me join y'all tonight. This is it's important that we have everybody out there telling all of our citizens what's going on and how they can still participate in some key things coming up in our state. You've already mentioned the census and the elections, but I'm going to focus more on the virus stuff itself. You've heard everybody talking, and I'm hoping this has been dispersed out, is things that we ought to be doing right now. One, and I heard it before, and I understand it's a natural human inclination, but we shouldn't be hoarding. Delivery trucks are still coming to stores. There's going to be supplies that are coming too. So if we can just take what we need and leave to the others, then we won't necessarily have some of the shortage that we're seeing right now. Now, I understand that seems kind of counterintuitive when you hear maintain your social distance, but we're talking to try to maintain a 6-foot separation as much as possible from somebody else. Now, that's easy for me to say as I'm at home in quarantine right now because I didn't follow that. But maybe I learned the lesson the hard way on that thing. But anything you can do to sanitize your hands, don't touch your face, maintain social separation. But most of all, and we have an inclination to do it, is spend time with our more elderly relatives and friends. We shouldn't do that right now because the highest number of people that are infected right now are actually millennials. But they're not showing the effects. They're doing more as carrying this right now than suffering from the impacts of it. And if they engage with like a grandparent or something, it could be really, really bad. Now, there's been a lot of talk about the shortage of test kits. We've been working with our federal counterparts to increase the numbers of those test kits that are sent to the labs for to see if you're negative or positive. And what they've been saying all this time, if you're not feeling any ill effects, then you don't need to necessarily use one of these, the few tests that we have right now. We're testing about 200 people per day in the state. And as you know, we've got about a little over 10.5 million people in the state. So we need to be, if you're not sick and you're doing all the things that you're supposed to be doing, then it's not quite the sense of urgency to get tested. I've not gotten tested because I'm not showing any signs, and my thought process is somebody else out there needs that one test more than I do. The other shortage that we've had is what's called PPE, personal protection equipment, for the hospitals. We just got a new huge shipment in from the federal stockpile, so that ought to help out in that area. And the question I got asked before, speaking of the healthcare area, is who is the priority for being tested? And the priority is the elderly those with a pre-existing condition that affects their immune system, healthcare providers, and first responders like EMTs. But those are the priorities right now. And the thought process is because of such a significant impact it makes on the elderly, and the fact that if the healthcare providers go down, then we'll be in a really, really bad situation. That's the thought process on why they're the priority. But it is still going up. It's going up at a high rate right now, but part of that is because we're actually testing more. Before we were just kind of guessing. Now we know for sure. And the thing that's hard for my family, but also should be taken into consideration for everybody else, is when you avoid large gatherings, that also includes houses of worship. So as much as we enjoy and appreciate and need to go to those services, we've had several hot spots come up because of people attending either funerals or church services, and we just need to be careful about that. But and I know that the good doctor coming up a little bit after me will have more to offer than that. But that's the gist of what I've gotten over the last few meetings with the governor right now, and I'll be standing by to answer any questions here at the end.
Thank you so much for that, Senator Dugan. We appreciate you being on this call. Thank you for that information. Next, we have Taifa Butler. Thank you. And for those of you, if you're hearing that the call is coming through broken, it is not your phone. Please stay on the call with us and just fight through. We're doing the best we can, so thank you again for your patience with that. Next, we have Taifa Butler, our Executive Director of the Georgia Budget and Policy Institute.
Good evening, everyone. I am pleased and thankful for the opportunity to join you all this evening, and I'm going to apologize in advance in the event that I cough or sneeze. I'm battling allergies, and this is not a good time to have allergies in Georgia. But I just wanted to add a little bit about the work that GBPI is doing and some of the main concerns that we have as we move forward in this public health emergency. First of all, I just want to thank all of our leaders, elected leaders, Governor Kemp and the General Assembly, for acting quickly and swiftly to get ahead of this. And what we've done to date is commendable. But I must say that the state must continue to act to do three things, and that's one, to mitigate the negative health outcomes that we are going to see that may persist for a while. The state has to support working families, especially those families with little to no income. And then three, I think we need to prepare for the long term. So I just want to hit on a couple of points in these three areas. One, concerning the health outcomes that we will be facing. Georgia has one of the highest rates of uninsured residents in the country. And so that is particularly of concern for residents who don't have access to a doctor, who don't have health coverage, and quite honestly, those residents who are people of color who are in fear of even seeking treatment because of their resident status. So we have to be really, really conscientious about how this is impacting communities in terms of fear, in terms of access. And so some of the actions that we are advocating for is that health insurers would be urged to waive cost sharing for COVID-19 testing, especially for those who don't have coverage and or may need to seek care outside of network or in network. And I know that the federal government has been talking about providing testing for free. We also understand that there is going to be federal funding coming down as that is determined, and especially whether or not there will be some stimulus package for consumers or individuals, and then also funding to help states bear the challenges around healthcare and the healthcare infrastructure. We know that's going to be utterly important for the state of Georgia, who right now is in a austere sort of posture because we've cut public health in our current budget, and the pending budget also has some cuts to some of our healthcare services. We are we knew that Governor Kemp had requested before the legislature approved the amended budget for this year that ends in June, that he asked for an additional $100 million of appropriation to help respond to this crisis. And that bill was signed earlier this week, or actually last week. So that is going to be really, really helpful to help provide purchase respirators, ventilators, and the personal protective equipment that we know is in shortage right now. And so that is going to be a plus for the healthcare outcomes for our state. And then finally, I believe that we have great opportunity to increase coverage if we look at Medicaid and what we can currently do within our Medicaid program. It currently covers telehealth and lab testing, but Georgia can also provide and leverage more flexibility by streamlining enrollment or expanding coverage right now. We can also seek some additional new waivers to help mitigate the access that I was talking about for hundreds of thousands of Georgians who don't currently have coverage. I know there has been a call and people have requested that the governor and the General Assembly consider expanding eligibility for Medicaid during this time. And so this may be an opportunity to do that. We've been debating this in Georgia for a number of years. There's also an opportunity for the state to apply for an 1135 waiver, which would waive some requirements for providers that would help them provide access to care and participate in the Medicaid program. And, of course, we have always said full expansion of Medicaid to at least cover more people in this moment is really, really important given our high uninsured rates. So those are the things that I think the state can do to help mitigate the negative health outcomes that Georgians may experience over the next couple of months. In terms of working families and families with little to no income, there is increasing economic uncertainty about how long we'll be in this posture where businesses will be closed. I've been on phone calls all week from national economists, budget preparers, budget strategists, and there is no doubt that we are facing a serious economic downturn. And I don't even want to say, but the two calls I was on today are projecting a recession and what that might mean for families. And I think what's particular about this is this recession or pending slowdown is really going to affect our tourism, our restaurants, hotels, food service industry, because a lot of those are being impacted by us having to be socially distant right now. And so as we think about what that might mean for those, waiters and wait staff and restaurant workers and hotel workers, that those are some of the lowest paid workers in our state. And if they are being laid off or will lose their jobs while businesses try to not shutter, that will have a tremendous pressure on Georgia's safety net and our services and our programs. And so we know that children who are right now not in school, I think this was already mentioned by Kevin, school lunches are being prepared for them. Local school systems and local governments are trying to make sure there's wraparound services there. But I think the state also has an opportunity to waive some of the additional eligibility requirements for some of our safety net programs like SNAP in particular, because people need to be able to put food on their table. So that's one of the things we've also asked. Since people have to be socially distant right now, people can't come in to apply for services. So we can waive those in-person requirements and allow people to file for unemployment. That might be helpful. Georgia has 3.6 million Georgians that live below 200% of the federal poverty level. That means 3.6 million Georgians earn less than $24,000 a year. And again, the industries that are being hit largely will affect them. And so we also are asking that the state consider some of these other measures. We wrote a letter to the governor to ask him to halt some of the statewide work requirements for able-bodied adults without dependents. The federal government has done that for the SNAP food program. We're asking the state to also match what the federal government is doing there. We're also asking the state to release some good cause exemptions, especially for people who aren't able to apply or seek jobs right now because of the posture we're in, that will be an allowance to enable them to continue to be eligible for food stamps or nutrition benefits. We've also asked the governor to consider suspending mandatory work requirements for SNAP, as well as restoring some of the funding in the upcoming budget, because SNAP caseworkers have been cut in the 2021 budget due to some of the shortfalls that we see. And if we know, based on this economic downturn that is projected, again, SNAP, TANF, some of our public health benefit programs will be sought out, and we will not be able to have the caseworkers to manage that demand. So we'll need to put some money back in the budget for that. And then finally, long term, I think once we get beyond this crisis, and we don't, again, know how long it will be, 3 months, 6 months, this economic uncertainty and potential recession is going to lag, particularly for these workers. And so we need to make sure we can protect the amount of revenues that we have as much as possible. We can't afford any kind of tax breaks or tax cuts at this moment. And I know the General Assembly had a tax cut measure that they were considering. So we hope that will be tabled because we can't afford it. We actually need to figure out how we can raise more revenue to support the state's services and the budget, especially as we go into a potential downturn where people will not be working. We won't be collecting income taxes. Sales taxes will likely go down because we're not purchasing, we're not renting hotel rooms. And so all those things have an upward pressure on our budget. So I will end there and just say, as much as we need to focus on the short term, the long game, the long-term needs of our state will persist. And we just have to be in a good position fiscally to manage through a potential economic downturn. Thank you so much.
Thank you, Taissa Butler, for bringing those details to us. We really appreciate that information. The next person we will have speak is Dr. Jasmine Clark, microbiologist, state representative with the General Assembly. Dr. Clark, if you're on the call and you're unable to mute yourself, we will come back to you to keep the flow of the call. We will do another opportunity for you to speak. Next, we have David Dreyer, Esquire, State Representative with the Georgia General Assembly.
Hey, first, thank you to the NAACP. Thank you to President Woodall and our moderator and everyone on. I just want to say earlier today that I've been on calls with the Atlanta Public Schools superintendent. I've been on calls recently with the mayor and the governor and other people, and the calls are having static, like you noted earlier. It's hard to connect. This is just how things are going to be for a while, but it's because people need information. So I really appreciate you putting this forum together. I'll say a few things and then try to get on to question and answer as fast as we can. But there's been some inconsistent messages kind of from the federal government on down. This is going to be a while. You all need to know what's ahead. They originally said schools were canceled for 2 weeks and the NBA was canceled for 2 weeks. I'm hearing from folks that schools probably won't go back in this academic year. We need to be prepared. We need to pace ourselves. We need to take care of ourselves and realize that this is going to be some time before we're able to get our country on its feet, get people working again. And that's just the healthcare part of it. There's going to be a time when we're all going to be hurting economically. So thank you for bringing this to the forefront so that people can have the information they deserve and that they need. The speakers you've heard have said so many good things. Kevin Miles was talking about the homeless and the incarcerated people. Briefly last year, we passed at the General Assembly a bill that banned the shackling of incarcerated women. especially while pregnant and in postpartum. And I would tell colleagues at the General Assembly that we were doing this, and they would look at me and say, no, we can't be doing that in our state. But I have to tell you, sometimes no one is in the rooms of power speaking up for women, people of color, people that are poor, people that are disenfranchised, people that don't have a voice. So it's our job to speak up for people in this time that are homeless, that are incarcerated, that are undocumented, because they need our help. From the Georgia Budget Policy Institute, Ms. Butler said exactly what we need to do. We need to think about an economic stimulus that's going to help everybody. And if we're bailing out companies, they need to pass those benefits along to the workers. It's great if the stock market does good, but our first priority is to help people that are everyday working families get through this. I didn't know the statistic that there are 3.6 million Georgians making under $24,000 a year. Shame on me for not knowing that. But that should stop us in our tracks. People there don't have the money in the bank, and I've been there in my life, and I'm sure there's people on this call that have been there in their lives if they're not on it now. We have to be a voice. You're empowered to be on this call. We have to be standing up for people that need our voice for when the federal government and the state government are continuing and actually start to provide real meaningful aid, that aid helps people that need it the most. Earlier today, I was on the call with the board chair of the Atlanta Public Schools, Jason Estevez, and the superintendent, Maria Christarfin. They are providing meals, as Ms. Butler said, but we're counting on our schools these days, because we don't have a social safety net, to provide 2 or 3 meals a day, sometimes 365 days a year or close to it. We're counting on schools to provide dental care, medical care, mental health care for acute mental health care disorder. That's not what schools were intended to do, but that's the only way that educators can do their jobs if we don't have a functioning social safety net. That's not going to continue indefinitely. These schools are making heroic efforts right now to feed our babies, our families that need food. But I'll tell you what, their capacity is going to run up against the wall, and I would like to say it's going to be a while, but it ain't going to be a while. It's going to be 7 to 10 days. We've got to be able to call on our National Guard to stock food banks, as other states are doing. We've got to start making those steps now, because in Southeast Atlanta, in my district, there are families that are hungry, and they're going to need help a lot sooner than we would like to think they're going to need help. So we've got to start making these steps in places that need the help in the metro Atlanta area now, so that when other states or other parts of the state are in crisis, they can get the help. And that other parts of the state already include Albany, Georgia, and some others. So we've got to think big. We've got to think about expanding Medicaid, like Ms. Butler said. Now's the time to do that, because doctors are risking their lives. They're working around the clock. They're not seeing their families, or they are endangering their families with this disease by coming home. And if we don't have expanded Medicaid, they're not going to be getting paid at all for it. So we've got to be doing that. We've got to talk about, like Ms. Butler said, the SNAP benefits. We've got to talk about food assistance to everyone. People that have recently been laid off, they need that processed extremely quickly. We need to talk about undocumented people that are going to need food assistance right now. People that work as hard as they can and put everything they make to their families are not going to be able to make money in this current climate. So I want to say that the government needs to be thinking big, both our federal and our state government. We have good leadership. I've seen the mayor of Atlanta do a good job, Fulton County, where I'm located, do their best to take the bull by the horns. Governor Kemp has leveled with us about what's going on here. He has been conservative, as he believes he was elected to do on expanding government programs, but he's listened. Now's our time to advocate. Now's our time to say, it's just not going to be getting better in the next 7 to 14 days as much as we all wish it would. Now's our time to be standing shoulder to shoulder with other people that don't always have a voice in the room. And if we can do that, it's going to be better for all of us. So thank you for being here. Thank you for being informed. And as we get off this, it will get better, but it's going to take our work. It's going to take our advocacy to make that happen. Thank you.
Thank you so much for that information. We are actually going to go back to Dr. Jasmine Clark, our microbiologist. Jasmine, can you hear us, Dr. Clark?
Yes. Sorry, I didn't know how to unmute myself earlier.
It's okay. You're in good company. You have the floor.
All right, so I want to come at this from two different angles. The first angle I want to come at this is from a microbiology perspective. I've heard a lot of misinformation about exactly what coronavirus is, and so I want to be clear about a couple of things. First off, coronavirus, I've heard people say things like, oh, it's just like the flu, and while, yes, it is a virus like the flu, that's about where the comparison stops. Coronavirus is a completely different class of virus than influenza. It has a similar pathway as far as it does affect the respiratory tract like influenza, but the difference is this particular strain of coronavirus is a novel strain. What that means is that our bodies do not have the antibodies already built in to combat this disease. Believe it or not, we have antibodies built up against a lot of different things that we'll come in contact with. Some things we'll never actually come in contact with, but we have the antibodies in our bodies ready for those things. We got them at birth. But with this particular novel strain, we do not have that. Now, the symptoms can go from anywhere to being asymptomatic to mild symptoms up to very severe symptoms all the way to fatal symptoms or death. And so I think it's important to note that you do not know where you will fall on that spectrum if you were to contract COVID-19. Do not assume that because you are between the age of 20 and 44 that you will be just fine and you'll probably just get a couple of sniffles and be okay. That has not been the case 100% of the time. While a majority of the hospitalizations and the majority of the deaths associated with COVID-19 have been of those age 65 and older, there have been people in the, quote, millennial and younger generations age range that have been hospitalized by this. So don't think you will win the COVID-19 lottery just because of your age. You do not know until you contract it. That being said, this virus is also a lot more contagious than other viruses. For example, it's a lot more contagious than what we've seen with seasonal flu. Now, we have flu vaccines, and so a large number of people vaccinate themselves against the flu, so that kind of helps mitigate the spread of influenza. But in this case, we do not have a vaccine nor a treatment, and we are finding that this virus is particularly contagious. So that's where social distancing comes into play. Social distancing is really important because the truth of the matter is with very limited testing, we do not actually know who amongst us may have mild symptoms and may be shedding virus. And when I say shedding virus, I mean you are potentially passing virus on to those who are around you. Also, and it's interesting, I just taught this to my class very recently, when a person coughs or sneezes onto a surface, virus can remain on that surface for several hours. And so you may not actually come in contact with a person who has COVID-19, but you might come in contact with a surface that that person deposited their COVID-19 on when they coughed or sneezed and it landed on that surface. That's why hand washing, sanitizing surfaces, just maintaining very good hygiene and sanitary practices is really important in preventing the spread as much as possible. when it comes to testing, one of the things that people have been asking me and I want to address on this call is that some people want to know, why does it take so long to get the results back? You might get tested on a Friday and not find out your results until Monday or Tuesday. The reason why is because the testing that we're using right now is based on something called PCR. So they'll do something like they'll swab the inside of your nose, or they might swab the throat and get a sample, and then they're looking for basically specific pieces of RNA that is associated with that particular coronavirus. Unfortunately, this is not a very quick process, and so these tests take a little bit longer than some of other tests that people might be used to, which are antibody-based and can be done a lot more rapidly, sometimes even on the spot. So that's a difference between the different types of tests that we use for viruses and why this one is taking so long. And last thing I want to touch on from a microbiology perspective is treatment. As I said, the symptoms can be a fever. It can be low grade, but it can also be a high fever. You can also get respiratory symptoms, specifically sore throat, dry cough. You might also get flu-like symptoms such as the body aches and soreness and a headache. These symptoms are not to be taken lightly. If you're feeling any one of these symptoms, you really should not be around others because you are contagious. It is being shown that you are most contagious when you feel the sickest. So if you're feeling these things, you really should stay away from others, really quarantine yourself, even from your family members. The other thing I want to talk about is the fact that there is no treatment for this. I know that there are labs that are trying their hardest to come up with a treatment for this, but when you're dealing with a novel virus, you kind of have to start from scratch. And while we're using previous treatments that were used on other viruses and trying to use those to treat this, right now we do not have an actual treatment, according to the CDC, the last I checked. And so what we must do is, at this point, the only thing we're able to do is treat symptoms. This puts an undue burden on our healthcare system, as people with more severe symptoms require things like ventilators. And there is a finite number of ventilators in our country, and in some parts of our state where we actually have lower access to just healthcare in general. Like, we don't have the hospitals, or we don't have the facilities, we don't have the ICUs. Those burdens are even higher because those people will have to go somewhere else. So also, our healthcare workers are dealing with a shortage of personal protective equipment, or PPEs. That's the masks, the gloves, the gowns, the things like that. Hopefully that is being addressed, because they are on the front lines, and the last thing we need is for them to get sick. Or what we don't want is for them to have to use the same PPEs dealing with COVID patients that they're having to deal with other patients that are not necessarily infected with COVID, and dealing with cross-contamination or spread in that manner. So we have protocols in place, but right now we're having to, from what I'm hearing from healthcare workers, those protocols are having to be loosened a bit because of access to personal protective equipment. And then I will finish off. As a legislator, I just want to say that we are in constant contact with the governor's office. We are relaying messages back and forth to the governor's office about the concerns of the constituency. And so if constituents do have concerns, it is really important that they do reach out to whomever that they know in a leadership role, so that we can get those messages to the people who are making the decisions. And if anyone has any questions about some of the decisions that have been made, I am more than happy to answer that during the Q&A portion. And so I will end with that. Thank you.
Thank you so much, Dr. Clark. I think we all needed to be enlightened of those details. Thank you again. Next, we are going to have Matthew Wesley Williams, Interim President of the Interdenominational Theological Center. We're going to give him a few more moments to be unmuted. We can hear you. Welcome.
Can you hear me?
Good evening.
Thank you for Thank you for convening and for having me on this call. Again, I'm interim president at the Interdenominational Theological Center, historically black theological school here in the heart of the west side of Atlanta, Georgia. And we have been really advocating and seeking to inform the faith community about the way that it can contribute to flattening the curve, to advocating for the most vulnerable among us, to providing areas of service, and also to really speaking peace to a situation of great chaos. Recently, actually last weekend, we hosted a national call of clergy, particularly black clergy and faith leaders, ahead of Sunday morning. What we were concerned about is what was named earlier on the call, which is that we were concerned that congregations and worship services will become hotbeds that would exponentially increase and compound the spread of the pandemic in our communities. And as you know, congregations are often sites where elders and people with underlying conditions and disabilities are often concentrated. And so if those become hotbeds for that kind of exponential transmission of the disease, then we will be looking at pretty high levels of morbidity among our people. And so to get ahead of that, we wanted to attempt to break through the noise of misinformation, underinformation, and a lack of information, and also to break through the noise of bad theology that was contributing to some people dismissing good public health information. And so we recognize that here in this state and also just more broadly, churches often are hubs where people, if they're not listening to anyone else, they're listening to a trusted source of information from the pulpit. And so we wanted to enlist congregations as broadcast towers so that they might get up-to-date information that they're not getting from other sources, and be able to again dispel myths, but also encourage preventative behaviors and help their congregants to understand how the disease is transmitted, and therefore what they might do to protect themselves and their communities. What we're recognizing is that in the congregations and pastors that we both help to cultivate, but also are connected to in the state and beyond, is that they are, once they receive reliable information by being connected with good public health, medical, scientific sources of information. And last week we were working with Morehouse School of Medicine as our kind of outlet for that information. They begin to do things differently, right? And so it's important for the faith community, the public health community to be in constant conversation as we know more about the spread of this pandemic and preventative measures, to be able to communicate clearly and reliably to the faith community. What's begun to happen, and we saw as a result of that call, is that pastors began to host online gatherings. Now, while they weren't holding, most of them weren't holding full worship services, most of them transitioned to a small team of people who then live streamed their worship services and that sort of thing. And their efforts weren't perfect, but they were certainly moving in the right direction. And now we've begun to identify technology specialists and other resources that are helping folks to move in that direction more effectively. Now, one of the questions that has come up over the last week, and I assume that this is going to be a growing question as we deal with some of the outcroppings of the spread of this pandemic, is how do we handle funerals? Certainly, people are passing on a daily basis, but as those deaths rise and churches are called on to commemorate the lives of loved ones, how do they handle that? Well, there are a number of alternatives that are being really kind of on the spot developed by pastors and church leaders. For example, some churches are only allowing the immediate household to attend the funeral in person and live streaming for the rest of the family and the community. Some pastors are doing a brief graveside service only for the immediate family. And when it comes to any obituaries and those kinds of materials, to limit paper exchange and the possibility of virus transmission on surfaces, they're producing electronic obituaries and programs for friends. Some are just holding off on funerals and memorials until the crisis ends, or hosting virtual times of remembrance and suspending funerals and repasts until these restrictions or restrictive guidelines from the CDC are lifted. The basic principle, of course, is that we're not going to risk death in the celebration of life. And so folks are trying to figure out alternatives to gatherings. Now, what's happening, though, as a result is that, as you know, most churches survive through tithes and offerings on Sunday mornings. And so what's happening is that while churches are not gathering, folks are not giving. And it threatens over time to really weaken the role and the capacity of congregations to be the kind of stabilizing and community building forces that they have been in our communities. And so now, as a result, for the first time, actually, churches and faith-based organizations can apply for small business, for SBA loans, for small business loans, in their disaster relief category, which provides up to $2 million for economic injury or business disaster loans. And for faith-based organizations, there's a lower interest rate than that for small businesses. So the interest rate that's being offered is about 2.75% over a 30-year term that attempts to provide some support given the economic impact that churches and faith-based organizations are likely to see in these times. So that's some of what congregations are doing to switch how they gather, to limit the transmission, to help to flatten the curve. Of course, all are not doing that, but many are, and we're encouraged by those kinds of responses, those faithful responses. Again, once those pastors and church leaders have access to good information. Where that's also very important is that, of course, the immediate inclination of congregations and church-related organizations is to be of service to the most vulnerable among us. We've seen examples like that of here in the city of Atlanta, a faith-based nonprofit called Love Beyond Walls, providing water stations for houseless people to wash their hands out of a recognized need that there are many places where people just don't have access to clean water, right? Other churches here in the Atlanta area, for example, are serving as way stations for access to food and food deserts, partnering with local growers to establish alternative food distribution centers for people who cannot stock up, as someone said earlier. And some churches also have temporary housing facilities that they're offering to people as needed. But all of these we want to make sure that churches are able to offer in a safe way that doesn't put the servants at risk, right? And so, again, the connection between public health and the church is very important in that regard. What's also important is that alongside the other activists and organizers and leaders on this call and in the state, congregations and faith leaders have always served as important public advocates. And so there are a number of areas around which faith leaders are active and are being encouraged to be even more active in advocating on behalf of the most vulnerable among us. And so as funds are being released through a number of executive and other kinds of orders, there are emergency operating centers that are being placed all over the country, testing locations now that tests are being made more available, including some drive-through sites, and federal reserve funds or federal resources and reserve funds are being allocated to rural hospitals. The thing is, we want to make sure that those things that are being deployed in areas that where we know health disparities has limited our access to care and to resources that can keep our folks safe and give us a really good sense of how this pandemic is impacting our communities. So those are a few things that we've been encouraging folks to advocate for, to be mindful of in areas of service, and then also to be mindful of in the important role that churches play in offering community and gathering people in an alternative way. But finally, I think what's important to say is that one of the most important assets that our people have, individuals that have in the face of this disease, is their immune system, right? Which is mitigated by stress amid all of the chaos and concern. And so one of the key roles that congregations play, that faith leaders play, is helping folks to find some spiritual grounding in the midst of all of this chaos that enables them to care for one another, even as we encourage social distancing, to encourage connection by folks calling and finding alternative ways to connect. And so we want to continue to keep congregations strong and help them creatively, but in an informed way, continue to play the role that they've played in cultivating community and keeping folks safe and secure in relationship to one another. I should also mention that for congregations that are doing some of these alternative gatherings, there are a number of resources that are being made available free for congregations and other faith-based organizations. So, for example, the G Suite, the Google Suite of Office and Office technologies and gathering technologies like Google Hangout, Google Drive, those kinds of things are being made available to nonprofits for free. So there are a number of those kinds of resources out there that nonprofits and faith-based organizations can take advantage of nowadays that heretofore have been at cost. So that's all I have.
Thank you so much for sharing those details with us. We are all definitely going to make sure that we share this information with our communities and families and friends. Next, we are going to have Charmaine Ward Milner, Director of Corporate Relations of the Southern Company Georgia Power. I'm going to give Charmaine a few more seconds to try to unmute and join the call. Charmaine, if you can hear me, we're going to keep going to the next speaker, but we will give you another opportunity to speak after we go to the next speaker. Thank you. Next, we are going to have John Powers. Going to give John a few more moments to join the call. Okay, and actually we're going to have John and Julie Hauk. Julie, are you there?
Hello, this is Julie Hauk. Can you hear me?
Yes, we can hear you. Thank you so much for being here.
Hello, thank you. I'm Julie Hauk. I'm Managing Counsel for Election Protection at the National Lawyers Committee for Civil Rights Under Law, and hopefully my colleague John Powers, who's counsel in our Voting Rights Project, will be able to join me as well. I want to thank President Woodall for inviting us to participate in this very important and informational discussion tonight. We're going to talk briefly about elections coming up. I heard Jerry Gonzalez give a good statement about some of the issues that you're facing for the upcoming May 19th election. And I just want to highlight some issues that came up as we monitored elections just this week in Florida. And it was the first series of primaries that were really impacted by the coronavirus. And what we gleaned from seeing what happened in Florida and Arizona and Ohio, there's going to be probably problems still existing for voters on May 19th in terms of voting in person. And so it's very important for folks to, first of all, check to see if they're still registered to vote, and if they're not registered, to register. The deadline to register for the May 19th election is April 20th. Folks, if they've got a driver's license, Georgia driver's license or Georgia state ID, can register online. Otherwise, you can register through voter registration drives in person or through the mail, as well as through various agencies that provide public benefits in Georgia. So there's many opportunities to register to vote, and it's very important that you make sure you're registered and register as early as you can to make sure your registration has been finalized and you're eligible to vote in the election coming up. Secondly, it's very important, if you're concerned about voting in person because of the coronavirus or for other reasons, that you apply as early as possible for a vote-by-mail absentee ballot. And that's important because the deadline to request an absentee ballot in Georgia is the Friday before the election, which is May 15th. The problem with waiting till the very end, and we've seen this time and time again in Georgia, is that the application will be mailed out on that final day if that's when you apply. And then you only have a short time to get that ballot and turn it in or mail it in so it's received by close of polls on the following Tuesday, May 19th. And so if you've got college students who are attending college outside of Georgia or living outside the state who are registered in the state, or you are a college student who has been displaced because the school is closed down early because of the virus, and you're now temporarily living outside of the area where you were registered to vote, it's very important that you get those absentee ballot applications on file as early as possible so that you get your ballot in time to vote it and mail it back or bring it back on election day before 7 o'clock. Otherwise, it's not going to count. In Georgia, the postmark is meaningless in terms of returning the absentee ballot. It actually has to be received before the close of the polls. And then that's not the only thing you have to worry about with the absentee ballots. You need to make sure your ballot counts. So if you get a notice from the election office saying there's a signature match issue, there's a provision for an affidavit cure to make sure your ballot counts, you need to make sure that that's taken care of in order for that ballot, even if it's received timely, to count. There's a lot of variations for overseas and military voters. You can glean that information from the Secretary of State's website. But I think overall, people should be very conscious of the issues around whether they actually want to go to the polls on Election Day or not, and that's your right to vote by mail if you're a registered voter in Georgia. What we saw in Florida, unfortunately, was that there were many last-minute polling changes that had happened because of the virus situation. The governor in Florida made what appears to be a very wise decision of not allowing poll places to be open to the public in assisted living facilities and other facilities that serve seniors and folks with medical conditions. And so those decisions were made pretty close to the end of early voting in Florida, and there wasn't a lot of notice as to the relocation of those polls, so that created some confusion. And then we also saw in Florida that many poll workers, many of whom in Georgia as well as in Florida are over 60 years old or may have medical conditions of their own, decided that they didn't want to put themselves at risk serving at the polls and would pull out at the last minute and on Election Day. So they actually had to make poll changes on Election Day because they didn't have the staffing to open the polls. So these are reasons why folks should be really seriously considering exercising the option to vote absentee in Georgia by vote-by-mail ballots if they have any concern that they are reluctant or can't because of illness themselves or illness of a family member to vote in person on May 19th.
Thank you so much for those details. John, are you also on the call?
Sure. Charmaine?
Charmaine Milner, are you? Oh, that's Charmaine. Charmaine, are you here?
I am. I was on before, so sorry. It just wasn't unmuting. Yes, this is Charmaine Ward Milner. I'm Director of Corporate Relations with Georgia Power. Thank you all so much.
Thank you. You have the floor.
Oh, thank you. Thank you, President Woodall. And we really appreciate the opportunity to share information, and we really appreciate the partnership that Georgia Power has with NAACP. I just want to share a couple things, one regarding what we're doing for COVID-19 as relates to our employees, what we're doing as relates to our customers, and then just some other tips. So first of all, Georgia Power, it is important to us that our employees are safe. And keep in mind, many of our employees are members of NAACP. And so what we've done is, first of all, we have mandatory telecommuting for all of our employees that can perform their duties remotely. We've canceled any facility tours and external meetings. We have increased the cleaning of all of our facilities and aggressively sanitizing the work areas, and we've canceled all non-essential business travel, whether it's domestic or international. And so those are just some of the things that we're doing to keep our employees safe. But also, the second thing we want to do is we want to make sure that our customers continue to have access to energy and that we continue to provide clean, affordable, safe, and reliable energy. So we announced, and some of you may have heard, but if you haven't, that as of March 14th, for the next 30 days, we will not disconnect anyone that has energy with Georgia Power. So we will not disconnect regardless of the circumstances. For the next 30 days, there will be no residential disconnections. And we just encourage customers to continue to practice energy efficiency as much as they can. The second thing is we just want to highlight and reiterate some of the different assistance programs that we have. We partner with nonprofits, community and faith-based organizations to offer a number of assistance programs for our customers that need it. And so a couple of these are that we have a senior citizen discount program. So any Georgia Power customer that's 65 years of age or older who meets the income requirements is eligible for a discount off of their monthly bills. We also have low-income home energy assistance program, which some of you may have heard of, and it's referred to as LIHEAP. And this really, again, helps qualified low-income households pay for their energy bills. And then finally, the Salvation Army Project Share. And this is a partnership with the Salvation Army and Georgia Power where, again, customers can come in and they can apply for help with assistance with not just their energy bill, but their utility bills, housing, food, and medical necessities. If you want more information about these programs, you can go to georgiapower.com/energy assistance. So those are just some of the programs that are available, and those are always available, but because of what's going on right now, it's just even more important that our customers know that these programs are there to help them. The last thing that I want to share is that there has been an increase in scams. And so we really want to urge our Georgia Power customers to be aware of scammers during the COVID-19 pandemic. What we're hearing is that because people are already having a lot of anxiety, people are not having jobs and the amount of income that they might normally have, they're really worried. And so then somebody calls them and says that they're from Georgia Power and they're going to cut off their energy. And it's absolutely not true. So we want people to know that this is a scam and that customers should be aware of getting any phone call where someone is demanding payment via phone. Georgia Power will never ask for a credit card or a prepaid debit card number over the phone. And again, I just want to say this, Georgia Power will never ask for a credit card or prepaid debit card number over the phone. So if a customer or anyone you know receives a suspicious call from someone claiming to be from Georgia Power and demanding payment to avoid disconnection, they should simply hang up the phone and contact our customer service, or they can go, which is 660-5890. Or they can go, if you want more information about it, to georgiapower.com/scams. So I really just wanted to not take a lot of time, but I wanted to share with you that, Georgia Power has really, really taken a lot of time to come up with plans and programs and initiatives that are going to help keep both our employees safe as well as make sure that our customers continue to have access to energy. And by doing this, we want to continue just to demonstrate our mantra of being a citizen wherever we serve. And we're going to continue to do that and continue to be there for the community. Thank you.
Thank you so much. Are there any other speakers who are on the call who have not had an opportunity to speak due to muting issues? Okay. President Woodall, if you would like to proceed to the question, I'm ready when you are.
So first and foremost, let me just take an opportunity to thank all of our speakers that have joined us today. I'm grateful for each and every one of you and everything that you all are doing and have done and will continue to do for the people of the great state of Georgia. I also want to thank every person who joined our call tonight as we prepare to open up the floor for Q&A. As the phone gave you instruction, we see that several of you have already submitted your questions, so we're going to go to you all here in just a bit. But first, I just want to answer a few questions that were submitted online. There was conversation about persons in rural Georgia being kept up to date and in communication about what's happening. The NAACP, we're using our network, and one of the purposes for this call was to get people from all over the state of Georgia the information that matters most to them. There were several questions about not just health, but how this impacts our elections, how this impacts the census, and those kinds of things. And so as you heard tonight, that is something that we're in much conversation about, and it will be distributed amongst our units. And so we ask that you, if you are not subscribed to our website and our mailing list, to go to naacpga.org and submit your email address so that you can get all the communications that's coming from the state conference. There's also a question about education and universities and school closures. We would ask that as we receive those, we're going to put them into our periodic updates, but we would ask that you communicate with your local schools, and so the boards of education within your community, as well as the public school system there. Stay tuned to and plug into those organizations and those groups so that you can get the most up-to-date and relevant and correct information that's coming from them. There's another question from Ms. Alice Jones from Fayette County. She's asking, how can we connect with people, specifically millennials, to practice social distancing through the next months until more tests are available and improving medical treatment is discovered? Excuse me. So just to simply answer that question, best practices have been shared tonight. We ask that we all follow those and abide by them as much as possible. We're not on a mandatory quarantine or anything like that, as the governor's announced today. However, we're asking people to use their best judgment and follow the guidance that has been submitted and sent to us. As far as recommendations for our upcoming meetings, all of our activities and those kinds of things, we're taking it really week by week. We've already canceled all of our meetings for March. We have not made a determination as a staff yet on what will look like in April and May. However, I know that some units have already considered closing and canceling events of large scale. If that is your desire, we will support you. However, we are not mandating that people do anything outside of March until we get that information. So we're playing it as closely by ear as possible, because we don't want to be too preemptive, but also we want to be respectful for everybody's hard work and contributions and commitment to the work that we do. We'll be communicating with our national office as well when it comes to the national convention, and our regional convention has been canceled, so we don't have to worry about that. All right. There's a question about many residents do not know the presidential primaries have been moved, which will interfere with voter engagement. What is being done to inform residents of this change so that this will not cause another round of voter suppression? That is by Ms. Brittany Aladipopo. I believe I said that correctly. And if I didn't, my apologies. However, there's going to be a huge information campaign. Part of it is tonight, but the other part of it will be communicating again with our leadership around the state to ensure that everything that we can do, that we are doing when it comes to voter education and voter information. So those who are on this call, whether you're a candidate, whether you're a public official, whether you are just a faith leader or educator or just a family member, we're asking you to call your immediate circle and let them know the very specific updates when it comes to the election, when it comes to census, and we can send out talking points to you all if need be. But our main goal is to make sure that people know where to go, where not to go. I know the NAACP is in communication with other organizations about what that message campaign actually will look like, right? Like, do we want people to simply do the absentee or the mail-in ballots? There was a question of voter accessibility when it comes to individuals who don't have English as a first language. And so we want to make sure that we are working together with our partners in the movement so that we can ensure that everyone has access to the ballot. Our job as the NAACP is not necessarily just to get people registered to vote. Our job is to make sure that the very institution of the democratic process is protected. And so what that means is every single person who shows up to vote, one, should be able to vote, and every single person who is eligible to vote should have the opportunity to do so as well. And so our focus must be ensuring that we protect the democracy of this great country. All right, so now what we're going to do is go ahead and go to the queue and start asking questions. So the first person in the queue is able to go. You are live.
Hello?
Good evening. Can you hear me? Hello? Am I being heard? I follow the instructions, but I don't hear anyone. Hello? Hello?
Yes, ma'am, you are live. Go ahead.
Okay, thank you. This is Annie Grant. I am a Georgia resident, living in Union Point, Georgia. I am, a semi-retired teacher. I'm a widow of a Marine Corps vet. I am the Veteran Affairs Chairperson of our NAACP, also the Director and Chair of our Democratic Party here in Greene County. I want to thank first our President for doing this. This is my second conference call I've been on. I'm trying to get as much information that I can from wherever, and I appreciate Mr. John Little for all he does for this district. So I have really enjoyed and taken notes, and I want you all to know that there's 7 of us right now that has been doing absentee ballots. I finally have a good relationship with with the supervisor at the voters registration. Has not always been that way. but we are working closely together. And I feel pretty good about going forward with what I'm doing, but I have underlying problems. And also, my question is if Dr. Jasmine, I think it was, is still on. My mom, now I'm in my late 60s. My mom is 99, and she does well. But if I need to go to the store and pick up something for her, what is your suggestion? I mean, we wiped down her house. We got her doing that. Her CNA comes in. But I know on tomorrow there's some things that she wants. So what do you suggest that I do to protect myself and my mom?
All right, so let me see if we can get Dr. Clark back on here. Hold on just for a second.
Thank you.
So it looks like she has jumped off. However,
okay.
What I will say is to follow the advice of her medical doctor. That would be a question that you might be able to address specifically to them, because there are some underlying conditions that may be relevant to consider. So
yes. Well, I thought about just putting on a mask and gloves and run over to the Family Dollar and get what she needs, take it in, and come back out. I was just hoping the doctor was still on, but that's fine. I've gotten a lot out of what we've had tonight, and I'm going to pass it on. And we really appreciate it, and just want everyone to know that we all have to do our part. I'm alone, and my 5 grandboys, or 4 of them, is in college, and they had to come home. So we all are in this together. So we all just got to do our part. And we appreciate everyone that you all had on this conference call. Thank you so much.
Yes, ma'am. Thank you. So next we'll go to the next caller. You can go ahead. You're live. You can ask your question.
Hi, I'm Martha Jackson, DeKalb, NAACP. The question I had was for Reverend Matthew, I think. I wanted to know, has any consideration been given to any of the faith-based organizations in terms of their parking lot or areas to use as a drive-through for testing, since we do not have a lot of access to testing in a lot of the areas where there are needs. And I was wondering whether any faith-based organizations or any consideration or even have thought about that to use their parking lots as a drive-through testing area.
So President Williams has jumped off, but I will share that question with him, and we'll also make that recommendation to clergy and faith leaders to ensure that that is something that is offered as a possibility for mobile testing. So thank you for that question.
You're welcome.
We'll go to the next. We'll go to the next caller for a question.
Hi, this is Leslie Anderson. I'm in Roswell, and my question that I had is, what is the best form of advocacy for individuals and even community organizations in trying to help with the expansion of some of the resources that some of the elected officials were talking about in GBPI? So, for instance, I agree with everything everyone said, but now that I can't go down to the Capitol and talk to people, what do I do instead, and what are our best methods for affecting change on an individual basis while I'm sitting here at home?
So, Leslie, first, thank you for your question. That is an amazing question. And a few things. One, there's a network of people that have been working day in and day out to provide immediate resources, of which we're going to share with you all in a subsequent and periodic communications on tomorrow. And we're going to list all those different resources that are available and what people are doing, so that if you are willing and able to help, then that you would be able to do so. And several people have said that they would be willing to do that. But the other thing that we should keep in mind is that the legislature, even though they're currently in recess, that they're still having conversations right now ahead of when they return. And so communicating with our legislators about some of the issues that we've discussed over the past few weeks and months, we can have this as an opportunity to speak with them on a one-to-one basis without the pressure of a ongoing session. And so that is one part of it, so that we know that they're going to have to come back and finish up the rest of the legislative cycle. The other thing that you can do, there's a coalition of organizations that are working on a day-to-day basis to ensure that these kinds of conversations are continuing, so that there's no gap in our ability to be able to advocate for the issues in the communities that we serve. And so, Leslie, I can definitely plug you in and make sure that you're working within that space so that we can continue on that conversation.
Great, thank you.
No problem. All right, next we'll go to our next caller. We have about 2 more guys, so bear with us.
Hi, my name is Araika Alexander. I am part of Galeo as well as of the NAACP. I am a tax preparer, and most of my community that I serve are Hispanics. I try to contact the IRS in regards to a lot of people being afraid of coming into the office and signing in their paperwork and things like that. What have we heard in regards to see if in regards to the IRS and refunds for taxpayers?
So I know there's been a lot of federal conversation about stimulus payments. As far as IRS specific, I don't know if, matter of fact, is David Dreyer, is he still on the line? Let's see. He might be better suited to answer that question. Let me see here. Yes. Hey, David, are you there? Okay, I'm trying to unmute him. But generally speaking, the federal government is in constant conversation right now about what that actually looks like. And to my knowledge, that hasn't been announced as a final decision. So we're kind of all in a place of waiting until we know what that actually looks like. And I'm unwilling to go out on a limb and say this is what's going to happen, when the reality is none of us knows until it's actually passed. What that actually that stimulus package looks like, how much, who gets what, those kinds of questions have yet to be determined. And so until that happens and it's final, there's nothing really to report. And so that's why on this call I want to really focus on what we know to be certain and what to be sure, what's available for people on a day-to-day basis, right? So
my question wasn't in regards to the stimulus. Yeah, my question wasn't in regards really into the stimulus of what's being announced. It's, for instance, if I have somebody come in and they don't want to come in to sign their paperwork, am I allowed to still submit their paperwork? That's more of my question.
Gotcha. So I don't have
because I called the IRS and nobody could answer me.
Okay. Let me do this. Let me touch bases with you offline, because what I want to do is get you in contact with somebody who does have the answer to that specific question. And I do have a person who I can put you in contact with, okay? So send me a message. I think you have my number. Send me a message and we can talk offline about that and then get you a specific answer. And then what we'll do is follow up and send that to everyone as well.
And whereabouts do I go to send that message so I can get that information? Because I want to have that on hand. So if people don't want to come to the office, I'm able to, do their taxes via phone.
Right. What I can do is I can reach out to you directly, because I have your number, so I'll reach out to you directly.
Perfect. Thank you. I appreciate it.
No problem. All right. We'll go to the next caller.
Hello, this is Brian from Carroll County. This has been the most informative program I've heard yet on this. I really appreciate it. And my question is for the state legislators, if they're still on the call. When we look at the public health guidance, they're saying if we want to shorten and make this COVID pandemic go away, we need to do serious isolation now and have major public health resources going into tracking down people who are infected and the people who they came in contact with. What is the state going to do to make this happen? Otherwise, this could drag on for months, if not a year. And the corollary to that is if we're to make this go away, we want people to feel like they can leave work and not be in horrible financial troubles. Is the state going to increase the amount that they pay through unemployment claims? The current repayment rate in Georgia is very low. So 2 questions.
Okay, let me see if I can yield to one of our state legislators who are still on the call. Dr. Clark, are you there? All right. All right, hold on just for a second. Let's do this. All right, Dr. Clark or Representative Dreyer?
First of all, let me ask, how are you feeling in general before we get to how you're feeling about now getting forward again? How are you feeling?
All right, Dr. Clark. Dr. Clark or Representative Dreyer?
This is Taifa. Can you hear me?
Yes, I can.
Okay. I will defer to the lawmakers, but I was just going to say this is where the advocacy comes in from citizens, especially while the lawmakers are on this suspended time frame. We need to contact your state reps and your state senators to let them know how you feel about these issues. There are 2 leverage points, I believe, that can happen right now. We're battling a lot of background noise, unfortunately. But there's budget advocacy that needs to take place. The House already passed their version of the fiscal year 21 budget. Hello? Hello?
Yeah, we can hear you.
Oh, I thought I got disconnected. Okay. So I was just going to say in the terms of budget advocacy, the House already passed their version of the budget that would begin July 1. Most of the cuts that the governor's office implemented or had in the budget, the House restored many of them. But we all know that we're going to need to go back to that budget. So it rests in the hands of the Senate right now. So if residents want to do any advocacy around the budget in terms of public health, in terms of any of the safety net programs, now would be your time to contact your state senators to let them know that we need to increase additional appropriations for health care, for local public health offices, because the local public health offices are going to bear the brunt of a lot of the needs of the community. They're going to be the first line of defense and, offense, quite honestly. So I would recommend you reach out to your state senator, but also your state rep to say, we know we need additional resources put into the budget. And then in terms of unemployment claims, we already heard from the Department of Labor that since last week, unemployment claims have doubled in size, and that's just going to grow as more people get laid off and or lose their jobs. And so we've seen in states like Tennessee and in Michigan where typically the unemployment insurance program is a legislative effort where the lawmakers, pass what the rules are for eligibility, how many weeks of benefits, and we have one of the poorest UI benefit programs in the country. The governor has the ability to issue an executive order to change UI benefits. So he could increase it to 26 weeks. He can increase or waive the week or the month of waiting period. The governor has the power to do quite a bit to change the unemployment insurance program. So I think that's our line of advocacy. If people would reach out to the governor's office to say, we know our community is going to need more unemployment, people are losing jobs, and if he would issue an executive order to make that program better because more people are going to need it, that is the way to advocate.
And look, that was the best summary. This is Representative Dreyer. That was the best summary that I think anyone could have given. But I'll also add this: there was a substantial amount of us that both voted against the budget because it cut programs for children and all needy folks around the state. There were a substantial amount of House members that voted against a tax cut while we're cutting the budget at the same time. Advocate in the Senate, but on another note, both the House and the Senate, until we come back in session, have delegated broad powers to the governor, which was hard to do, but it was the right thing to do in the time of a public health emergency. Your legislators can pass along information, and they will, I'm confident saying, pass along information to the governor's staff in a direct manner, but direct advocacy for the governor is incredibly important right now, specifically when you're talking about testing, limiting the spread of the disease on an immediate basis, immediate emergency relief for unemployment benefits, food banks, those sort of things. That's going to be incredibly important. So, if beyond just calling, if you could get 5 people to call, who get 5 people to call, who get 5 people to call, which I know this organization knows how to do, we can put public policy on a better footing with your advocacy.
Thank you, Ms. Butler and Representative Dreyer. I know Dr. Clark was trying to hop on, so if you are listening, you can press *6 and you can make some comments as well. We don't want to miss you.
All right, I'm here. Can y'all hear me? So I would just reiterate what Representative Dreyer said, and I do apologize for the person who had a question for me earlier that I wasn't able to unmute so that I could answer that question as well. But, yes, honestly, right now we are in a place where the amended 2020 budget has passed and has been signed by the governor. But for 2021, which starts July 1 of this year, we are still in a place to make decisions. And I believe having this pandemic happen and all of the effects of the pandemic, we're going to have to start making some very important decisions. And I hope that those decisions are people, resident, community-focused decisions. But the legislature needs to hear from their constituency about what is really important, how they are being affected by this pandemic, and what is needed. And the concerns about UI benefits have been, I had multiple conversations about that with people just today, so I know that that is an issue. And again, we are in a place where we can have those conversations and try to work toward getting a budget that will actually help us in this just really unprecedented times. But now we're in a place where we can actually really have the conversations about having a budget that is focused on the people of Georgia, because if anything brings people together, it's something like this where everybody is on an even playing field, and it doesn't matter how much income you have, we are all in this together. So I think this is a good time. But reaching out to your legislators now, both House and Senate, is a really good idea.
Thank you, Dr. Clark. And so before I make closing remarks, I wanted to, thank our moderator, Ms. Noelle Singleton. If she's still on the line, I want to give her a last opportunity to share a few words with us. So, Ms. Singleton, are you there? Okay, I don't believe. Hold on just for a second. She is here. Let's get her on. All right, Ms. Singleton.
Yes, I'm here. Thank you. So, firstly, I just want to take an opportunity to introduce myself. I wasn't able to do that due to the muting initially, but I want to thank you for inviting me to be a part of this and to moderate this conversation. My name is Noelle Singleton, and I am a swim coach and an aquatic director. I started a company called Afro Swimmers, where we increase diversity in aquatics through the power of representation and through images, which means I'm on social media a lot. And a lot of important topics were brought up during this conversation, but one of the things that was not addressed is the misinformation that is being spread through social media. As a millennial, I do not speak for all millennials, but as someone who really utilizes social media, not just in a professional stance for my business, but also socially, I have seen a lack of presence from advocates, government officials, where they are doing something active to counteract all of the misinformation that's being spread. It's being spread through memes. There are live conversations of young people where they're spreading details, what they think are facts. And from what we heard from our microbiologist today, a lot of the stuff that we think we know about this virus is completely wrong. And because we are misinformed and this misinformation is spreading like wildfire, it's aiding in the misbehaviors that's actually making it worse for everybody. And another concern is a lack of trust. Because there is so much misinformation going out there, and then you get on a call like this, and I'm getting all of these details that I've never heard before, and I've been watching the news. And so the issue is that we're being told now that young people are actually significantly being affected by this virus, where before most of us thought that it was just affecting the elderly, that they were the most vulnerable. And we're being told, well, if you don't have symptoms, stay home. But when I go on Twitter and Facebook and Instagram, I'm seeing actual people sharing stories of how they are distributing and showing symptoms and being turned away from medical facilities. But then we'll see a celebrity who is in the United States hop on and say, I don't have any symptoms, but I've been tested. That is a direct contradiction to the information that was provided tonight. But this is what we are seeing every day right now on Instagram, and I can provide facts, information, and screenshots. So it's creating a distrust. And if we're going to overcome this and actually prevent even more panic, we have to do a better job of getting the facts out to people in the way that they are communicating. This call is extremely powerful and effective. However, unfortunately, the millions of people who are on social media right now who are not on this call are not going to get these details. And yes, they can go on certain governmental websites, but we have to make this information more accessible. And so I really would like to know, what plans do we as a body through the NAACP plan on doing to interact with people and meet them where they are? This call is great. The information that we've shared tonight is great, but it's not where it needs to be to reach the most people. How do we tackle that? And how do we help establish more trust when we're being told one thing, but we're actually seeing another as we are experiencing it in our everyday lives?
So thank you, Ms. Singleton, and really thank you to everyone. I want to answer that question in my closing remarks before we conclude and adjourn for the evening. The purpose of today's call is very clear. And sort of like what Noel just shared, our job is to not just take this and keep it for ourselves, but it's to really use the strength of the network of the NAACP to get the message and information and the resources out to the people in our communities. The NAACP here in the state of Georgia comprises of over 130 units across 98 different counties. 98 different counties. And our job is to take the information that you heard tonight and be able to synthesize it in a way. And we've been tweeting highlights, so if you miss something, you can go to Twitter or Facebook, or we're going to send this out via email as well. This call was recorded, so you can go back. We want this information to get out to the people who need it. Not saying that we don't need it, but they need it as well. The other question that we had was centered around bandwidth of traffic, the new traffic that's going to be coming through the internet. I believe we do have the capacity. The servers are from fiber optic to, the infrastructure is there. Our job now is to get the infrastructure, the access to infrastructure to those who don't have it. So we heard last year talking about access to broadband in South Georgia. That's something that the state is working to implement and to strengthen and to invest in, because we know that access to information is so critical, specifically during times of crisis like what we are experiencing now. And so you're seeing companies like Frontier and AT&T and Verizon and Comcast and Cox all put in invested resource into ensuring that everybody has access to the internet. So in coming days, you're going to see more of that roll out. Now, I will say, I want to just take a moment to thank three special individuals who have helped coordinate this call. Aaron, Crystal, and Angel. They have worked tremendously hard over the past few days, our communications team, to put this all together. And so I wanted to just take a moment of special privilege or personal privilege to thank each and every one of them for all of the work that they have put into this and making this such a great success, and all the work that they're just committed to doing in the name of the NAACP. I'll thank you all. I look forward to sharing with you all in the near future. If you have any other questions that did not get answered tonight, you can feel free to send them to us directly. You can get to us on social media at Georgia_NAACP, or you can go to our website at NAACPGA.org and submit them there. Also become a subscribing member to our website so that you can get up-to-date information on what is happening. If you're not a member of the NAACP, we always will welcome you to become one. Again, thank you all and good night.